Hello, Untamed television fans. This is your host, Craig Bielik. Today, sitting here with our guest, Dr. Tyler Christensen, a urologist with Ogden Clinic. Welcome.
Welcome.
And we're going to talk today about prostate gland, prostate health, and we're also going to tell you men out there how you can get a free prostate screening, a PSA test to be exact, on October 16th at Ogden Regional Medical Center. But we'll get to that later. Okay, we got a lot of ground to cover today.
Yes, we do.
And you're ready.
I'm ready.
You like this stuff.
I do like this stuff.
You do like this stuff.
Yeah.
I mean, just briefly, what is the prostate? And it's prostate, not prostrate.
Not the prostrate.
Right.
Prostrate's something else. So no, prostrate. It's a gland. It's an organ in the body located beneath the bladder.
Okay.
Main goal is to help and assist in reproduction, and then unfortunately, as men age, two things: it enlarges, causes problems urinating. We talked a little earlier about the getting up a few times a night, starting to have a little stop and start in the morning. And then unfortunately a big discussion is prostate cancer, which is what we're here to discuss today, and prostate cancer awareness, prevention, and what we can do to make sure that there's no untoward events from prostate cancer.
Right. And to be clear, prostate cancer is still a problem. It is a deadly cancer.
Prostate cancer is still a deadly cancer. Prostate cancer is the second leading cause of non-skin cancer death in men, next to lung, not because prostate cancer is a deadly disease, because 1 in 6 men get prostate cancer.
Right.
And very interestingly, as you said, is it still important? This has been the first year that the death rate over a lot of years have actually risen from prostate cancer due to people thinking that it's maybe not as important as it should be.
Right. And as far as prostate cancer prevention goes, it's not like other cancers. There's not a lot you can do to prevent it other than the screenings, which we're going to get to.
Absolutely. And that's that some patients are like, hey, how do I have a healthy prostate? What do I do? Interestingly, we recently went to a conference and they've done lots of tests, lycopene, tomato.
Right.
The conclusion is heart healthy is prostate healthy.
Okay.
So eat a healthy diet, exercise, weight control should be adequate for prostate health.
But you can't eat almonds or extra tomatoes on your salad. Or
It's definitely not going to hurt, but really help. Tough to know.
Yeah, those are healthy things.
Absolutely. Now, heart healthy is prostate health.
But there are two things you can do to prevent it, and they are both tests, right?
Absolutely.
Right, and the first one is the traditional.
Well, the big thing is, again, PSA screening.
Okay.
Talking about our screening coming up, the blood test is probably one of the most important things you can do. It's a stick like any other blood test. I mean, we joke about the finger wave, but probably more important is the blood test.
So how does your blood, how do they, I mean, this is a dumb question, but how does your blood know if your prostate's healthy?
No, very interestingly. So if you look back in the late 80s, early 90s, they found out there is a chemical that's produced by the prostate that shows up in the blood called PSA. It stands for prostate-specific antigen. It is a chemical actually made by the prostate that aids in reproduction. And that unfortunately one of the causes of an elevated PSA is prostate cancer. Not the prostate cancer causes elevated PSA, but the cancer distorts the architecture in the prostate and causes that number to elevate. And in the 80s, we just determined that is a potentially screening test similar to mammograms for breast cancer that men can have that can help us detect prostate cancer at a much earlier age, that we can identify when it's still treatable and curable.
Okay, so a man, first off, over 40 is the recommendation. Is
well,
that correct?
we've kind of, it's a moving target. And again, the whole reason why prostate cancer, PSA screenings potentially had bad press over the last 5 to 7 years, because we've determined that maybe we're over screening, we may be checking too many men and potentially subjecting too many men to untoward treatment. So I definitely agree that if there's like an early family history, say your dad had prostate cancer at 55, it's completely reasonable to have a PSA on the chart in your 40s. Potentially high-risk populations, we know that African American is independent risk factor for prostate cancer. I definitely agree the 40s. If you look at the hardcore screening recommendations, American Cancer Society, American Urological Society, 50 to 55 is now probably a more reasonable time that we can get the first PSA on the chart.
Yeah, interesting. So you have the PSA, simple blood test, just like you say.
Absolutely.
And it comes back with a number. And if your number is high for your age and recommendations, but that doesn't mean you have prostate cancer,
that
right?
absolutely does not mean you have prostate cancer, and that is one of our key goals right now, is to be not as much to screen, but be judicious on screening, and then decide who we need to move on to potential more definitive diagnosis, screening, and tests.
Right.
And so if you look at potentially all comers, we usually say about 25% of men with an elevated PSA can have prostate cancer. One thing that I know that we do now is definitely do a confirmatory test. So just off one number, maybe there was an error in the lab or something. Mm-hmm. So rather than suggest the next step is a biopsy, rather than subject them to that type of a treatment, maybe the first chance is just go get another test, or maybe wait 3 to 4 months. We know it's a very slow growing disease, recheck it and see what the number is. Is it changing? Is it raising and lowering? And then help us decide further on treatment.
Do you find that some men's number, if you watch them over a couple of years, bounces up and down?
There absolutely is fluctuation, and I guess that's one of our jobs as a urologist, to take that risk and help patients through that and be able to watch it and really know when do we need to get excited and when can we offer assurance.
Right. So it can be elevated for a number of reasons, and one of them can be cancer.
Cancer.
There's also, like you say, I've heard it referred to as, the prostate's a working man, and as he gets older, he retires, and he doesn't, he's not making children. And like a lot of men with time on his hands, he starts to get in trouble, and he gets a little bigger, and that sort of thing. But
yes. No, other things that can elevate PSA. One of the big things we look for is infection. Uh-huh. Say some gentleman, he has a little more frequency, urgency, potentially pain. The classic is, I feel like I'm sitting on a grape. That could be a sign of infection. Sometimes, again, we want to rule out laboratory error. Mm-hmm. You can sometimes have vascular problems with the prostate, where you can potentially temporarily lose blood supply, although that's very rare.
Wow,
I think these are some real reasons why it's important to recheck, do a confirmation before we do biopsy.
Okay. All right. And then, of course, there's what they call BPH, right?
Absolutely. And it is something that we do like to educate, that there's not a confusion. There's two issues that can occur with the prostate. One, we talk about prostate cancer. Two, BPH, benign prostatic hypertrophy, means as men age, the prostate can grow. And then not necessarily growth is a sign of cancer. It more leads to those what we call voiding difficulties, the frequency, urgency, weak stream, getting up at night. That's a sign that the prostate is potentially enlarging. Again, totally separate from cancer. A gentleman can have a very large prostate, voiding difficulty, but not have cancer at all. You can have a gentleman with a very small prostate that can have cancer. So that's why it's important we follow symptoms. We usually do a symptom score. How well do you urinate? How's your stream? How many times do you get up at night? Do you feel like you're emptying? Versus then the prostate cancer, the screening test is the blood test. And BPH symptoms don't necessarily correlate with cancer, and vice versa. You can have somebody with no voiding difficulty at all, and they can still have cancer, hence the need for the screening.
Well, and then you also do the second screening, which is the ever popular,
absolutely,
digital, as they call it.
The little finger wave. But again, I know it's not the most comfortable procedure, and we don't have men knocking on the door for it. But I think it's a lot easier to go into a lab, get a simple blood test, and then that may help us decide further who do we need to do an exam on or not, and decide what their risk is for prostate cancer.
Right. And before we move on to a new treatment also for the BPH, I want to mention that Ogden Regional Medical Center will be having a free prostate screening. This is for men. All you have to do is call us. We're going to put the number on the screen here in a moment, and register. There's no obligation, anything like that. It's not the finger wave. It is the PSA. The results are mailed to your home along with a recommendation.
Absolutely.
Whether you need to follow up based on your age and all of those sorts of things. So again, information here at the bottom of the screen. But you did mention the BPH, which basically is a big prostate. Right? It's just become big. It's pressing against
the old man disease.
The old man disease.
The difficulty urinating.
The old man disease. There's a new treatment for that. There's several treatments, but a new one.
Absolutely. Historically, your grandpa talked about the Roto-Rooter,
right.
the barbaric treatment that occurred in the hospital.
Yeah.
We still offer that treatment, although has come a long way. We use some minimally invasive. We now have laser treatment.
Wow.
We have what's called a bipolar button, which is a new high technology form of energy that has less thermal spread, less injury, less complications, much quicker recovery. But now there's a treatment called Resume. Mm-hmm. And interestingly enough, it's a minimally invasive office-based procedure, and it's thermal. It uses steam. It's steam treatment on the prostate.
Wow.
and we go in and essentially deploy a needle into the prostate. It shoots a 1 centimeter plume of steam. That steam kills the cells, which then opens up the tube and helps men urinate a lot better. We've seen a lot of success, and potentially for younger gentlemen, the 52, 57-year-old guy who's maybe concerned about the hospital procedure, potential side effects, sexual side effects, leakage, although very uncommon. This minimally invasive office procedure is something that may be a little more easier to swallow, quicker recovery, less pain, and with excellent results. Some people are saying, hey, is it really too good to be true? The nice deal is we have 5-year data that shows that it is very similar to the classic Roto-Rooter. Oh. The other situation that's nice is, say you're 57, we're looking at prostate health over the next 30 years. Maybe you get this treatment, and then 20 years down the road, you get the treatment in the hospital. But it's a nice option. Our other option is, now with an aging population, we're getting some older gentlemen who are still having some significant urinary issues, but due to other health problems, COPD on oxygen, heart history, they may not be a candidate for a surgical procedure. This is another excellent option for them, and we've seen a lot of success.
A lot. You like your job.
I like my job.
You know what? I don't know if you guys are getting that out there, but this guy likes his job.
I do joke that I am a plumber, and I'm a very happy plumber. So we're here to open up the tubes and pipes and make men happy.
There you go. Well, guys, if you're watching out there and you're having some of those little plumbing issues, we're not talking about the sink. Again, a free PSA event, screening event at Ogden Regional Medical Center on October 16th. There's the phone number right there. Give us a call. We also have some education with that event. Dr. Christensen is going to be there to talk a little bit about these treatments, and pull him aside and consult with him a little bit. He'd be happy to do that, and take care of your prostate so that it'll take care of you on that kind of stuff. Again, my guest today is Dr. Tyler Christensen with Ogden Clinic. I am your host, Craig Bielik. You have been watching Untamed TV in our fabulous brand new studio. Maybe you can't tell. Maybe it looks like our old studio, but this is our new studio. The first guy on camera. Broke ground right here. Thanks for joining us, and we'll see you again.
Untamed TV. Untamed.